They contacted my parents. I was 13, and they said Mr. Balanchine would like to invite her here to New York for the school year. Then when I was 16, I was invited as an apprentice into the company, New York City Ballet, and I stayed there for 15 years. I began to have trouble with my right hip about 6 years ago. I was running a program in the Bronx, New York for younger children, and I was trying to show the children the proper way to jump off of a box. Well, I jumped off the box and I felt something go, and then from then on I was in pain, and my leg actually got a little shorter. It somewhat retracted. There were times I couldn't even lift my hip to demonstrate. There were nights at home where if I didn't have a heating pad on and ice and everything, I just couldn't even sleep comfortably.
She had constant pain with all motion, especially weight bearing or attempting to do any type of ballet move caused sharp groin pain, which is classic for hip arthritis.
It became very apparent to me that I absolutely had to get a hip replacement. So I found Dr. Callander and I read his bio, and I just had this feeling this is the right guy. When I got there, there were posters and framed pictures of dancers in San Francisco Ballet with autographs thanking him for taking care of them. And I just, I just took a deep breath. I went, oh, he really does do ballerinas.
Understanding that she is a dancer, it's important to pick the correct type of hip replacement procedure that will meet her needs. By doing an anterior hip replacement and going through the front, we don't have to cut the muscles. And so by preserving the muscles, it allows for the patient not to have as much pain and allows for a quicker recovery. We just put your legs to sleep and you take a little snooze medicine. And then when you're done, we get you up walking right away, and we use medicine that allows for the pain to be well controlled. And so you don't have that fear of pain after the surgery. Additionally, you also are able to get up and be more mobile quicker. And by having that quick return and mobility allows you to return to work, get back to your normal lifestyle, and be able to do the things you want to do and not be limited. And we're now doing these surgeries as an outpatient procedure, which is very exciting.
Concierge approach to describe the Presidio Center is the perfect word. There to serve your every need, your every worry, your every fear. It's like a boutique surgical center, like a fine boutique hotel in Europe. I loved it. The entire Cal Orthopedics operation it's remarkable. You really feel the presence of this incredible team around you. It's really comfortable, and within minutes, they had me in the back and ready for surgery. Dr. Callander came in for a minute, and boom, the next thing I knew, I was awake and I had a brand new hip.
You can see that the right hip has lost the joint space in the ball and the socket, and that's bone on bone, and when she walks or puts pressure on that, it edge loads and causes pain. This x-ray shows the results of her anterior hip replacement, where the stem and the socket are well fixed to the bone, with the ball forming her new ball and socket. No longer does she have bone on bone, but a nice smooth socket that is stable and allows her to return to an active lifestyle.
Recovery was incredible. I just was not prepared for how easy it was. I was up and walking on crutches out of the surgery center within 3 hours of the surgery. Within 3 days, I was walking and doing PT with just a cane, but able to put weight on both legs. Within a week, I was ready to dance. I really felt like they just had to kind of hold me down. I was back in the studio in 2 weeks. I was fully functional in a month. My actual experience of having this surgery is 300% better than what my expectations were. I'm so happy. I just got my life back.